is we're going to be talking about speed pitches. So we invited a number of the leading experts on a number of the most popular resources that are available in Canada to provide us a bit of information about what they do. So we're being led by Dr. Bill Howatt from Howatt HR Consulting. Bill, I've got your bio here, and I do have your 2 sentences, but I will say this. Bill has over 30 years of experience in mental health and addictions. You published over 300 articles, and you've been an instructor. I will say this, that I always enjoy talking to you, Bill. It is always a very fascinating conversation. Bill, as I understand, is involved in the revisions to the Psychological Health and Safety National Standard, which I believe we will touch on as well. And Bill, if you want to just say a few words while I bring up your presentation here.
Welcome, everybody. I had the opportunity just to listen to a few minutes. I was working on delivering another workshop, and just walked over. I think what I'm excited about to share with you today is a couple ideas around getting access to resources that are price points that are meaningful. My framework that I'm committed to now in workplace mental health is we've done a lot of work on the plan and the do. We've done all kinds of talk about what we're doing and where we're at. As a part of the standard, one of the things I think is really important as we start to evolve towards that as our North Star is how do we get meaningful data to move from informed evidence to evidence-based. The initiative I'm going to share with you is something we started to do, a commitment to creating conversation around creating psychological safe workplaces. We've already have a national award. I'll share at the end some of the sponsors that are involved in this and to give us our credibility behind this. If you go to the next slide for me, I'm not going to spend much time on myself. Just one thing I would like to say to you on this day is that if you see all the stuff I have, I've lived my entire life with a mental illness, and we don't come with science. And I think if you start to ask yourself, what is the impairment of this concept? What I want to spend time talking about to you is helping people to identify. One of my motivations for doing this is from behavioral health. So when we see people in the workplace, there was all kinds of evidence that 1 out of 5 Canadians have a mental health issue. We may not be talking enough about is what the challenge is for me, is that 70% of the 1 out of 5 are not getting help, but 5 out of 5 Canadians have mental health. And so I really want to start educating the difference between mental health and mental illness and starting to move towards behavioral health. But on that, if you go to the next slide, Michael, is someone who has a different lens, because I look at the world through a clinical lens, through an HR lens, and I look at it through a lived experience lens. What we wanted to do is create an instrument that organizations could be using to get evidence. Now, not a lot of organizations, unless they're bigger, will have people that can do stats, create evidence-based tools, go through the process of validating surveys, and et cetera. But what we wanted to create was not a survey. We wanted to create an assessment tool to provide employees back with information. So really quickly, if you're familiar with what the standard is trying to do, reduce mental harm, promote mental health, then those things we call hazards, like, for example, the great work that Marianne and the team are doing all around Guardian Minds, identifying there's these hazards and factors. So we have exposure to workplace mental health issues, and that can result in distress. But the protective factors, organizations now have all kinds of programs in place. So we've created an instrument where you can take all your different programs and put it into tool, and then the employees can get their reports in real time of where they're doing in regards to their own mental fitness, but also in regards to their experience around factors, stigma, etc. So you go to the next slide for me. We want to give employers actionable data. We want to be able to give both the employee in real time where they're at, and then we want to give the employer in real time, once all their employees, giving them a confidential resource. So we use the same service, for example, for data security integrity, that a company out of Montreal, very similar to organizations, like CISAs, et cetera, would use this level of security. So data integrity, confidentiality, making sure it's really, really clear. But our motivation for me doing this is to create a community-based program. And the accessible to being able to provide employers, a small businesses in Canada, which is before COVID, around 1 million, to get access to an online assessment tool that they get psychological health and safety, where every employee gets their own personalized report. And being able to do that in a credible manner for less than $500 was my goal. So working with the Mental Health Commission of Canada, getting guidance on ideas around making things accessible and listening to what Excellence Canada is doing and listening to, we came up with this idea of how to do it. Now, I've been involved. I was chief of research at Morneau Chappelle, and I was chief of research at Conference Board Canada. I spent a lot of time in data. We want to make this really simple and user-friendly so that we can give to organizations the factors that are providing impact. If you go to the next slide, Michael.
And just so you know, Bill, you have 1 minute left.
Yeah. So the participating in award, what happens is that folks get share accountability, benchmarks, joint responsibility, traction, et cetera. So if you go to the next slide, because what we really want to do, yeah, the other one. If you go to the website, there's a lovely video, but you start to see the sponsors we're starting to attract and the different organizations that are getting involved. So if you want to learn more about this tool, that's an economic tool for small, medium, large business to get data and does program evaluation, includes the employees and two-way accountability. I hope you check out Psychological Safe Workplaces and see what we're up to.
Thank you, Bill. And again, the purpose of this is to introduce you to some of the folks who are behind some of these major resources. And I know we won't be able to get into the level of detail with speed pitches that obviously would be ideal, but if you want to reach out directly to Bill in the chat, or Bill, if you can put your email address into the chat function as well, he can certainly follow up with more information. The next speaker is Marianne Baynton, who is unable to join us today because she has some prior commitments. We work very closely with Marianne on a number of initiatives, including some research that you'll see later today. She works with Workplace Strategies for Mental Health, which is a nonprofit fully funded by Canada Life. And she is behind initiatives like Guarding Minds at Work, which she helps facilitate, and her resources are freely available on her website at Workplace Strategies for Mental Health. I'm going to run a video from her. So if you'll bear with me for 1 minute while I pull up that video, and then you'll be able to see it.
Hi, my name's Marianne Baynton, and I'm with Workplace Strategies for Mental Health. We, in 2022, may be feeling a little overwhelmed, a little tired by what we've all been going through, but we all have a role to play in managing our own mental health and really protecting the psychological health and safety of those around us. The resources that I'm going to describe in the video that follows are available to everyone, to anyone who wants to be a champion for workplace mental health. Please check them out and start to make a positive difference for yourself, for your team, for your organization today.
Welcome to the world of Workplace Strategies for Mental Health workshops. We hope this video will help you facilitate workshops with ease and confidence. Workplace Strategies develops free resources to foster positive mental health and to protect psychological safety in all Canadian workplaces. Our tools and workshops are evidence-based and designed so anyone can use them. Each of our workshops comes with a facilitator guide, participant handout, and slide presentation. Most of our workshops are designed to run from 1 to 3 hours and can be adapted if you have more or less time. It's a good idea to go through all the materials before the workshop. There are sometimes preliminary steps recommended, like reviewing your organization's policies, getting information from leaders, or completing surveys or assessments. Let's go through each of the core workshop materials, starting with the Facilitator Guide. The guide is designed so anyone can present the workshops as is or modify it to suit your workplace. For example, you'll find suggested wording you can change to meet the needs of your audience and your personal and organizational style. The guide also gives directions to help you facilitate the chosen topic with confidence. You'll find a list of suggested workshop materials like sticky notes or a whiteboard, tips on promoting the workshop, suggested wording for each presentation slide, tips to manage discussions in a psychologically safe way, and actions to help make positive changes. The Facilitator Guide also includes links to our online resources that can help increase your comfort level and effectiveness in managing responses and attitudes. The handouts align with the Facilitator Guide and presentation. The handouts give helpful information and space for notes. This way, participants can capture and refer to what they've learned and agreed to do next. There are notes about the workshop process. The handouts can be printed or used digitally. The slides are clear, visually appealing, and align with the Facilitator Guide and handout. One way to modify the workshop is to add your organization's specific content. For example, you may want to add slides related to your own resources, policies, procedures, or strategies. If you add slides, it's a good idea to build in extra time to cover them. Whether you're a leader or consultant, there are many workshops with everything you need to facilitate in organizations of all sizes on a wide variety of topics. For a complete list of workshop resources, go to clwsmh.com/materials. All of our resources are available in English and French. After you run the workshop, we'd love to hear from you. Our tools and resources evolve with user feedback and changes to the workplace, legislation, and organizational needs. All workplace strategies, tools, and resources are available to anyone at no cost, compliments of Canada Life. Use them to support employee and leader success in your workplace.
You can improve workplace mental health for your organization, your work team, or your career. Since 2007, Workplace Strategies for Mental Health has helped employers, leaders, trainers, and employees develop strategies that support success at work for everyone. With free, ready-to-run workshops and resources to help support performance and employee well-being at work, and help employees deal with life stressors, you'll find exactly what you need to create and sustain a psychologically safe culture at work, all with no strings attached. Because at Workplace Strategies for Mental Health, our goal is for more Canadians to work in environments where they're given every chance to thrive. Visit our website today to find out more.
Oh, again, sorry that Marianne is not able to join us here today. She has prior commitments, but again, I'm going to ask Brittany or Sarah if you could put the website down in the chat so that anyone could directly access that. Next, we're going to be joined by the Mental Health Commission of Canada. I see Charles is here. I'm just pulling up the controls for Liz as well. 1 second. Sorry, where is Liz?
I'm here.
There you go. Thank you, Liz. Sorry, my apologies. Was struggling with the controls there for a second. Yes, we're joined here by Charles Boyer. Charles, I don't know if your camera is on. You can't turn it on, but they're with the Mental Health Commission of Canada. The Mental Health Commission of Canada has 3 primary resources that they are working on. Mental health first aid, which a few organizations have mentioned, the Working Mind and the Inquiring Mind. There are over 800,000 Canadians in their programs, and they are excellent programs. I've been through them. Liz and I have had a chance to work together on a few projects. including the working group for some of the research we'll show later. Fantastic individuals. Charles, I don't know, can you hear? Charles, are you connected?
I'm
Okay.
here. It's too bad I have a suit on, Michael.
I don't know what's going on with your camera, but I have, it seems to be on your end. I'm sorry, I can't do
It's
it.
all good. It's all good, but I do have a suit and a tie for the first time in a very long time.
Yeah, I hear you. I couldn't bear myself for a tie today, but I hear you. It's all yours.
Okay.
Oh, I'm going to pull up
Sorry,
your
Michael, am I sharing my screen or?
I will pull up your presentation right
Oh,
now.
okay. All right. Thank you.
Here it is.
Well, we'll start off by saying hello and that we are so pleased to be part of this this important event, and wonderful to see everybody here and listen to all of the conversation and participate in it. And you know, Mental Health Research Canada is doing some great work out there, so we're really delighted to be part of this. So thank you for inviting us. So we want to start off with just a little bit of if you could go to the next slide, please. Oh, where did it go? It's disappeared on my screen. I can't see where it is. Here we are. Nope. I've lost it.
I can see it, Liz. I see you now. So prevention is worth a pound of cure.
Okay, thank you. I'm sorry. I seem to have lost it on my screen. I apologize. Okay, so you know, we know that anxiety and depression and substance use and thoughts of suicide, these things are all increasing. We've got research that shows us that. And we also know that access to mental health services is not keeping up with the need. And there's a well-known quote from Benjamin Franklin that an ounce of prevention is worth a pound of cure, and we sincerely believe this. So talking about mental health in our workplaces is a key part of that prevention. And it really starts with three key questions. What am I experiencing that's affecting my ability to function my best at work and outside of work? What support do I need in the workplace? What support do I need to help me function better and to succeed? And who can I talk to? If you could go to the next slide, please. So we know also that stigma, even self-stigma, is a major thing that prevents most people from reaching out for help. And as part of our mandate at the Mental Health Commission of Canada, we provide training and we support organizations to reduce and eliminate stigma and to develop effective workplace mental health strategies. And our new workshop that we're doing for foundations of an effective workplace psychological health and safety strategy is for people who are leading workplace mental health programs in their workplaces, and it helps with creating a strong foundation by considering how to address issues that drive stigma. So we get people talking about stigma, about unconscious bias, issues around diversity, equity, and inclusion, toxic positivity, and what needs to be in place at the foundational level to create a psychologically healthy and safe workplace, as well as how to measure success. And this is all in alignment with the National Standard of Canada for Psychological Health and Safety in the Workplace. And we also consider anti-stigma training to be an essential part of a workplace mental health strategy. So I'm going to turn it over to my colleague, Charles Boyer, to talk to you about the working mind and mental health first aid.
Thanks so much, Liz. It's such an honor to be here. I'm so sorry I can't see you, or you can't see me. I have a big smile on my face with a suit for the first time, like I mentioned. But this is a really great day today. You know, I reflect on years ago with the Bell Let's Talk was my catalyst to look at myself and my mental health, and then what I could do to help others. And it's really inspiring to be part of this presentation. And then it would catalyst me here, where I'm at the commission, where I get to help with the deployment, where we've trained upwards of 800,000 Canadians and beyond in our programs. The two programs that we have, and maybe Michael, we go to the next slide, if you don't mind, is the Working Mind and Mental Health First Aid. And the way you could think of these two different programs is one is focused on oneself, where that's the Working Mind, and Mental Health First Aid is focused on others. With our training programs and we're evidence-based, we heavily evaluated programs published in the Canadian Journal of Psychiatry with the reviews for the working mind, and with mental health first aid. There's 26 countries and millions across the globe that have trained in that program, heavily evaluated. But it's the length. One of the differentiators is the length of the program. So these are 5 to 9 hour training programs, and you spend a lot of time in with a small cohort. Virtually, we limit to 15, and in person up to 25. But in the working mind, we mainly focus on, as Liz mentioned, reducing stigma. You learn about the mental health continuum, and you learn about building resilience. And with reducing stigma, one of the big elements of the course is the first person narratives of contact-based education, where you're hearing the story of someone with a mental health problem and they get out and you can see the other side and the light at the end of the tunnel. So that's a big part of the course, of breaking that stigma where you can get better, as well as the continuum and resilience. One of the anecdotes from the course is with that continuum is it's taking that and having a conversation after, like today, knowing where you are and having a conversation with a loved one or a partner. Say, you know what, I think I'm looking at the indicators, think I'm in the orange, and that partner maybe noticed something in you, and actually you're in the red, and we need to make a phone call. So we see a really great identifying of where you are along the mental health continuum. With mental health first aid, one of the big changes with our virtual program, again, we trained over 500,000 people, is our concept of allergies, where you assess the situation, listen non-judgmentally, encourage sports, encourage other sports in self-care, but it's that S, the care and love that we can give to someone who may be facing a problem, and you apply that model. How often do you apply that model to yourself? How often do you look at yourself and you ask yourself, and you assess the situation, and you listen to yourself, and you give yourself a reassurance? So that's one of the big changes with our virtual course, but it really equips people with the tools to not walk by someone who may be experiencing a problem, which happens in a lot of different sectors where you don't have the confidence to start a conversation with someone. With mental health first aid, gives you that confidence to have and initiate a conversation with someone. That could be life-changing. And we've heard some really great stories from folks in the delivery of the program. So those are two of the programs that we want to touch on with you today. But it's really great to be here with Liz and with everyone on as part of the event. So thank you, Michael. Thank you, everybody.
Thank you, Charles. I'm sorry, I think your audio was a little choppy, but certainly what I would advise is, if you want to put in the chat links to your resources, I think it would be very interesting for individuals to hear a little bit more about that. Thank you, Liz, as well. Appreciate your contributions. I believe next on our list is Beth. I will pull you up, Beth. There you go. And I will give you a spotlight. Beth, I will pull up your presentation.
Thank you. I'm really pleased to be part of this panel today and to speak about mental health resources in our workplace, which is the entrepreneurship space. And first, I'd like to shout out and thank the team at Mental Health Research Canada for convening this event on this very special day. And of course to Bell, which has been a major supporter of RISE for many years, and in Monica's words today, has indeed made significant and lasting impact on us at RISE and our clients. So next slide, please. I'll just quickly tell you, RISE is a national charity, and we help individuals who self-declare with a history of mental health and addiction challenges to achieve their dreams by starting their own business. And there are three major elements to the work we do: small business lending, entrepreneurship training, and mentoring. And mentoring is something that we do in all parts of our programs. All of our lending clients have mentors, and we use volunteers in our training programs. We also use volunteers as subject matter experts for our clients, and they serve on our loan adjudication and other committees. So my focus today is on our workspace, our frontline workers, which are the staff and volunteers, and how we support them with a mental health lens as they work to understand the challenges that our clients face. How do we do that? We provide training for not only for our staff, but for the hundreds of volunteers that we engage each year. Our frontline workers, our staff, for them, we provide additional mental health training, as well as diversity, equity, and inclusion training on things like being trauma informed, some of the words we've heard today, intersectionality, oppression, bias, and the cycle of poverty. So what I want to tell you about today is 2 new resources that we've developed and deployed in the last year. So to the next slide, please. First, our toolkit for mentors and mentees in entrepreneurship. And I'm really happy. I'm kind of sad that Marianne Baynton wasn't here in person, because I'm pleased to tell you that this resource was informed by feedback and experience of our RISE clients and volunteers, and developed in partnership with Canada Life's Workplace Strategies for Mental Health, and specifically with Marianne Baynton. She advised us personally on this. So this toolkit was designed to bring greater mental health awareness and supports to mentoring relationships amongst entrepreneurs. So the kit's got all kinds of really great resources in it directed at both the mentor and the mentee. There are worksheets and questions and exercises to help build trust, set expectations and goals, navigate difficult conversations, and to focus on self-care. And because we believe that the content of this toolkit is relevant far beyond our own workspace and even beyond entrepreneurship itself, we've made it publicly available. It's on our website. Anybody can access it, and we promote it widely at certain points of the year, especially this month. Today, National Mentoring Month has been January, and also during National Volunteer Week in April. Next slide, please. The second resource I want to share is our new online mental health training modules for staff and volunteers. So this Understanding Mental Health is a 40-minute course designed to be completed over several weeks. It covers concepts such as the impact of stress on ourselves and others, the difference and relationship between mental health and mental illness, and then we heard that brought up a couple of times today, and how to maintain positive mental health and well-being. So the course helps our frontline workers, who are our staff and our volunteers, to build positive, practical skills to support their coaching and mentoring of our clients. We have a second module coming out focusing on stress and power, and that will be coming out next month. So the content for these courses was specifically developed for RISE by 2 highly experienced psychotherapists, one of whom had also taught some of our entrepreneurship training programs, and so had firsthand knowledge of the challenges faced by our clients, quite outside of the challenges of starting a business, there are lots of them. So this is what makes RISE unique in the self-employment space, not just our specific focus on a target market of individuals who experience mental health and addiction challenges, but also our commitment to supporting the staff and volunteers who support those clients. So you can move to our last slide. Thank you. That's how to find us. And happy Bell Let's Talk Day, everybody. Thank you.
Thank you so much, Beth. We're really wanted to make sure we focused on small business and entrepreneurs and resources, because a lot of these resources are typically looked at. A lot of the other ones are in large businesses, but there are resources for small businesses and entrepreneurs. And we really appreciate all the work you're doing on that. I wanted to turn it over to someone we collaborate with regularly. Ken Porter is joining us from Mood Disorders. Ken, I'll let you say hello while I pull up your presentation.
Yeah, thank you very much, Michael. I appreciate it. And thank you very much to MHRC for bringing everybody together on Bell Let's Talk Day, and to sharing all this great information and resources and making it available to the wide audience. It's amazing the progress that we've made. I mentioned this in our breakout route, how much progress we've made over the years in understanding how important it is to disclose and talk about our own mental health issues and our own struggles. and the power that comes along with that. So today I just wanted to give a quick little elevator pitch on who Mood Disorder Society of Canada is. It's really just because trying to think of a 5-minute thing that we could talk about, I want to highlight a couple things, but there's just too much to cover. So I just wanted to quickly introduce who we are. So if you go to the next slide. So Mood Disorder Society of Canada is a national nonprofit. We're a lived experience driven voluntary health charity, ensuring the voice of Canadians impacted by mental health illness. Family members and caregivers are heard on issues related to mental health and mental illness, and in particular regard to depression, bipolar illness, and other mood disorders. So we're very much an organization that focuses on the voice of those who sometimes do not have a voice or feel like they do not have a voice, those impacted by mental illness. And I'm very pleased that things have come up to the point where we're making more progress, and more people are opening up and having these kind of conversations, but there's still so much work that needs to be done that we just continue to move forward. One of the things that's very important to us is partnership and collaboration. So a lot of times you'll see in our work that I'll show you in a second that we focus on collaboration, and that's kind of the key part of who we are and what we do. So we go to the next slide. So obviously, advocacy is an important part of what we do. We work with federal governments to implement improvements to mental illness and healthcare in policy and in budgeting, and just try to push forward the optimization of the mental health care system in Canada. We actively partner with like-minded organizations like Mental Health Research Canada and many others that are currently in the room. So I'm glad that we've had the opportunity to work together. Provide a national clearinghouse of information and resources related to mental illness and mental health. So we provide resources that are available free for downloads on our website and free to participate in any of our training courses. And we try whenever possible to make the resources at least to minimal cost, but mostly free. So we work to eliminate the barriers to full community participation and reducing discrimination and stigma among the public, healthcare and service providers and governments. So it's important that those who feel like who have been struggling with mental illness feel that they're not separated from the community, that they're part of the community, and they're engaged in all aspects of life. And of course, in doing so, we're raising awareness of mood disorders, that mental illness is like any other illness. It's treatable, and it should be looked at as another illness. It shouldn't be seen as something different than that. And ensuring that the voices of persons that are impacted by mental illness are accurately understood and communicated on a national importance in collaborative networks. So it's important that we kind of share that voice collaboratively as much as possible in as many ways, and try to propel that message forward. If you go to the next slide. The next slide. So what we've done is we try to, I don't know if I'm not seeing it. I haven't seen it. There you go. Sorry, I don't know if it froze up. So some of the projects that we've worked on before is, there we go. Thanks. So of course we've worked with Mental Health Research Canada in developing the post-pandemic strategies, and the report that we'll be talking about coming out later on. And we're conducting the survey about emergency best practices with Mental Health Research Canada. We engage with so many organizations online. We have multiple websites where we disseminate this information, including the Depression in the Workplace website. One of the resources we just introduced was this Depression in the Workplace section with free downloadable resources and training guides. And our workplace mental health guide, which takes the psychological health and safety standards and kind of breaks it down into a little bit more digestible steps, so that people can, again, implement it as easy as possible. You can go on to the next slide. There we go. And of course, some of the other things that we do with like collaboration, I talked about. So we've worked in the past, we've done some training programs for primary care physicians, for nurses, for legal profession, all working in collaboration with major organizations in order to make sure that those individuals feel that they're receiving the information and understanding as much as we can. We're extensively working with the public through social media and outreach and things like that. And of course, our international recognized anti-stigma campaign, The Elephant in the Room. It's quite glad that that program has been out there. We've been able to work with some fantastic organizations and start the conversation about how important it is to have safe places and safe spaces at work. So if you can go on to the next slide.
Sorry, Ken, I'm afraid we're running low on time, so we just finish the slide and we can.
Yeah, this is exactly right. Okay, this is fine. So this is the most interesting program that we're just working in right now in collaboration with University of Alberta, University of Saskatchewan, Dalhousie University, and APEC Digital Hub for Mental Health. We're creating a artificial intelligence-based information broker system navigation tool in which that's patient-centered and provides needs analysis as you're chatting to it. It provides complementary services as well as supports all mental health system players, and it's scalable so that we're growing this. Right now, we're starting off working with healthcare workers because obviously they're the sector that has been most impacted by COVID-19 and pandemic. So we want to provide as much support to them as soon as possible, and that's where we're going to start. So pay attention to that, and that'll be coming up more soon.
Fantastic. Thank you so much, Ken. I'm sorry we didn't have more time to chat through this, but I also acknowledged I lost the controls there for a second. We're being joined by the Canadian Mental Health Association, by Heather, who I believe. Hello, Heather. Oh, I can't hear your Heather. I can't hear your audio. I'm going to.
Can you hear me now?
I can hear you now. Great.
Okay.
So, if you could, I'm sorry to do this, but could you just say hello while I pull up your presentation?
Yeah, absolutely. And I'm late arriving to this meeting. It's just been a very busy day, and it's back-to-back meetings, etc. But I did join in right at the time that Liz and Charles started giving their presentation. And I just have to admit that, oh my goodness, with the little bit that I've heard so far, we are all joined by a common thread with a common cause. And I think it's so wonderful to see so many synergies between our respective organizations, knowing that our cause is to create a mentally healthy world. So I'm especially delighted to be invited to this particular event, and want to thank Mental Health Research Canada for including me in your invitation list. I've been working with the Not Myself Today program for the better part of 8 years. And in keeping with the Mental Health Commission's discussion, I just want to mention, and Liz and Charles, I don't know if you're aware or not, but Not Myself Today actually has our original roots as a strategic initiative within the Mental Health Commission of Canada. So at the same time your organization was creating our brilliant national standard, you're also creating Not Myself Today as a really easy how-to piece for organizations to start adopting the standard within your workplaces. So we do have very deep roots in mental health. We've been driven by charities for the last 8 years, but that's where our roots come from. Next slide, please. The concept we really want to focus on with this workplace mental health initiative is that we all have mental health. I know that this is probably a statement that's been made throughout the course of your conversations today, but we all have mental health, and it's only right that we learn how to create a more open and supportive work environment. Next slide, please. And while that slide is coming up, I just want to talk to you about the foundational cornerstones of Not Myself Today. Really, what we have done is created a very unique approach to creating open and supportive work environments. With our program, we take the heaviness out of the topic of mental illness, and we make it very, very approachable. Sometimes it's not what you say so much as how you say it that can really make a difference. And it's the relational tones of the program the simplicity in which learning and delivery of the program is deployed, and the socialization elements that are embedded within the program itself. It's not only a great place to start the conversation, and we know that with Bell Let's Talk, this is their mandate. Let's start the conversations. Let's just open up a dialogue about this important topic. But with Not Myself Today, it's also a great way to sustain that conversation over a period of time so that we in turn can start catalyzing workplace culture transformation. But I am going to talk about the bottom 2 bullet points on this page for a brief moment, just to give you an overview. Really what we do with our program is provide all employees, not just selected managers, not just selected supervisors or executives. All employees get involved in the program, and we provide all employees with very practical, easy to understand literacy about peer support, about creating our own self-awareness, and being open and supportive in that type of context. The social conditioning is very, very significant. And again, this is the cornerstone of Bell Let's Talk. This is also the cornerstone for Not Myself Today. Because what we really want to do is start normalizing the conversation about mental health and mental illness, and making sure that our colleagues know that it's okay to not always feel okay, and it's okay to talk about it. So the notion of practical literacy and education, typically delivered as 5-minute icebreaker learning discussions at the onset of your regular or your virtual team meetings, is the way the program is deployed. Minimal amount of employee time required, minimal amount of effort for the people who would be leading these 5-minute icebreaker conversations, but sustainable over time so that we start catalyzing culture transformation. Next slide. These are the 3 specific areas of desired outcome that Not Myself Today delivers in. Awareness is huge, but also with that common understanding, providing employees with that common language from which to support supportive conversations from. Stigma reduction is huge, as well as enabling all employees to continually demonstrate the fact that you're creating a safe and supportive work environment. Next slide, please. There are physical tools associated with the program. There are also digital tools. What's wonderful about our digital portal is that, especially with the onset of the pandemic, we have taken all of our materials and digitized them. So all of the physical tools also have representation if you are an organization who is still currently isolating or servicing remote employees. What's really nice about Not Myself Today is that everything is delivered in a workplace context. But the beauty of the program is that what you are really delivering to your employees are life skills that they take with them wherever they go. So not only are employees more comfortable to support a coworker or a colleague with mental health challenges, but also a family member, a friend, a neighbor, a loved one. And now, as we're all navigating through our pandemic recovery and whatever that looks like for all of us, these life skills are so incredibly important. And there's also a significant hunger in our employee base to be able to provide them with some helps, such as Not Myself Today and all the other great programs that were mentioned earlier. 5 core learning modules that are associated with the program. And what we've done is taken each of the learning modules and broken them into little 10-week micro learning sessions that takes 5 minutes of employee time once a week. So there's a continuity of messaging built into that. This is where we get into the notion of sustainability so that we can catalyze culture transformation. There's a variety of different tools that are there to provide those 5-minute learning discussions. But you know what's really cool about the program is that employees love it. It's simple, it's relational, and it works. We really do create more of a buzz in the workplace and a much more substantial comfort level with employees through this program. Next.
Sorry, we're just running out of time. We have about 30 seconds left.
Hey, I think I'm done.
Oh, great.
How do you like that?
Perfect timing.